Welcome to Tuesday's edition of COVID-19. Our daily caseload has hit above 400 today as we mark almost 4 months since the start of our third wave. So what is challenging our containment efforts and what lies ahead are the questions we ask our panel of experts later on in the program. Here now is Al Kwon-soa with the pandemic updates. So I hear there's been a surge in cases here in Korea on this Tuesday.
Right, Sunny. Exactly 100 more cases compared to Monday. 446 infections were reported as of 12 a.m. And with that, also domestic transmissions are now at above 400. And we're seeing daily caseloads now lingering in the 300s and 400s throughout this week and throughout the past weeks mostly. And that raises the total number of infections here in the country to 93,263. And the death toll at 1,645. Now, more than 300 infections broke out in the capital region, and especially here in Gyeonggi-do province, we're seeing a surge by 60 cases compared to yesterday, and that's mainly attributed to a cluster infection at a livestock facility, which now accounts for more than 70 cases. And it is those big and smaller cluster infections breaking out at workplaces, schools, and medical facilities, private gatherings, and many more day-to-day activities that could become more difficult to contain with warmer weather conditions. This is why authorities are not ruling out a fourth wave of the coronavirus here in the country before most citizens are vaccinated against COVID-19. Now, speaking of vaccinations, so far, over 383,000 people have been vaccinated here in the country, with 64,000 vaccinations happened yesterday, and our Yoon Jung-min is going to break it down further in a bit. And yes,
right.
Back to you, Sunny.
So I was just going to ask you, I understand there has been debate that has been rekindled over vaccine passports.
Right, and especially in Europe, as the European Union on Monday local time confirmed they started to work on a so-called digital green pass, which would allow free travel among fully vaccinated EU citizens. Now, while the EU is expected with a draft published later this month, the World Health Organization is not that fond of that idea, as an official is citing practical and ethical issues. Let's take a listen.
At the present time, the use of certification of vaccination as a requirement for travel is not advised, because quite simply vaccination is just not available enough around the world, and is not available certainly on an equitable basis.
And these kinds of passports are also being under review here in Korea as well as in the US, while countries like Germany are strongly backing that vaccination passport, and so are also Southeast Asian countries like Thailand, especially tourism spots. And let's take a look at the global figure of COVID-19 cases. We have over 309,000 new infections, which raises the total to 117.7 million. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Back to you, Sunny.
All right, so thank you for that. Right, now for more on the vaccination efforts here in the country and elsewhere around the world, I have our Yoon Jung-min in the studio. Welcome, Jung-min.
Hello, Sunny.
Right, Jung-min, then let's begin with the number of people here who've received their first dose of the COVID-19 vaccine.
Right, Sunny. So as Soa just mentioned, over 64,000 people were inoculated, yesterday alone. And in total, over 383,000 people have gotten their first dose in the 11 days since Korea started vaccination programs. And on average, over 60,000 people a day received their vaccines over the past week, excluding Saturdays and Sundays. On weekends, the numbers fell sharply. Korea now has vaccinated around half of its population in phase 1 priority groups. Over 80% of those in nursing hospitals have been inoculated, over 27% at medical centers, and almost 50% at care facilities. Vaccines are also being administered at major hospitals in the capital region, including Seoul National University Hospital and Samsung Medical Center. By region, Gyeonggi-do province vaccinated the most number of people on Monday, with over 11,000, followed by Seoul and Gyeongsang-namdo province.
Right. Jung-min, what's the latest with regard to post-inoculation adverse effects then?
Sure, Sunny. So health experts say over 4,800 adverse reactions have been reported so far, but they say most mild symptoms were reported in most cases, and such as including a fever or headaches. But they are taking a close look at the adverse reactions that are severe allergic reactions. Well, yesterday, the KDCA held a briefing on 8 post-vaccination death cases that have been reported here in the country. They have concluded for now that there was no correlation between the death and the vaccines that are being handed out. Take a listen.
We've looked into the 8 post-inoculation deaths to determine whether they were caused by anaphylaxis, and we have confirmed that there were no reported symptoms to indicate this was the case.
Health authorities added that they found no critical flaws in the vaccines, while those who died were all suffering from underlying conditions. For further analysis, the authorities plan to carry out an autopsy on some cases. KDCA Commissioner Chung Eun-kyung advised people to monitor their own health before getting a vaccine and to let their doctors know if they have any allergies or chronic health conditions. She also asked people to continue monitoring their health for about 30 minutes on site and up to 3 days at home post-inoculation.
Right, and I understand that's very important. Meanwhile, how is the vaccination campaign advancing in countries outside Korea?
Right, Sunny. So in the U.S., new COVID-19 cases are on the decline, well, since vaccination started after peaking over the winter. Well, according to data by CDC, over 9% of the total population, or around 31 million people, have received their second doses as of Monday. Now, the number of people in the U.S. who have received their 2 doses outnumber the total number of COVID-19 cases in the country. On Sunday, the U.S. added around 40,000 new coronavirus infections, which is still high but well below the peak of over 300,000 daily cases seen in January. This has prompted several states to lift their mask mandates and social distancing rules in public spaces. But health experts warn that figures could spike again. Take a look.
It may seem tempting in the face of all of this progress to try to rush back to normalcy as if the virus is in the rearview mirror. It's not.
Now, over in the UK, more than 1/3 of its population have received their first dose, putting Britain in the lead among European countries. The UK began reopening schools on Monday, and Prime Minister Boris Johnson says vaccines made it all possible. Take a look here.
Tomorrow, the 8th of March, is the first big step of the roadmap that we hope is a roadmap to freedom. And it's made possible by the rollout of the vaccination program.
The UK aims to gradually lift lockdowns starting from schools and then followed in later stages by the reopening of shops and other venues. According to media reports, some businesses and pubs may be allowed to reopen starting in April. In the final stage of the country's phased reopening, which will take place no earlier than June 21st, the government hopes to remove all remaining social distancing orders.
I see. All right, Chungmin, as always, thank you very much for the coverage.
Thank you.
Right, it's a little after 2 in the afternoon here in Korea, and we are waiting for the regular briefing on the local COVID-19 situation for this Tuesday. As mentioned earlier, cluster infections at workplaces and other everyday settings are hindering containment efforts, and authorities are calling for strict adherence to COVID-19 prevention measures and preemptive testing to curb the rampant spread of the virus here in the country. Let's now take a look at our current safety measures. The Greater Seoul area faces level 2 social distancing, while the rest of the country is under level 1.5. The ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes. The briefing is about to start. We'll come back to you afterwards.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for March 9th, Tuesday. As of today midnight, we have 427 new local infections and 19 new imported cases. The total caseload now stands at 93,263. And we also have about 69,402 tests conducted yesterday. And in the metropolitan areas, makeshift testing sites, we carried out about 28,000 tests, and a total of 65 confirmed cases have been identified. And we have 426 more people making full recovery and being discharged, while 7,718 still remain in quarantine. There are also 128 patients with critical or severe conditions remaining unchanged from yesterday, and we also have 3 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Here are some updates on our domestic infections in the metropolitan area. In Seoul's Dongdaemun-gu district, in relation to the 3rd hospital, we have 4 additional patients being confirmed. In total, we have 17 cases being confirmed to date. And in Gyeonggi-do Province, Ansang City, in relation to the livestock wholesale market, we identified 59 additional cases, raising the total to 77. And in Gyeonggi-do Province, Uijeongbu City, in relation to an hospital, we identified the first index case on the 3rd of March. We identified 15 additional patients, and in total, we have 16 being confirmed to date. And in Gyeonggi-do Province, Dongducheon City, in relation to a foreigners cluster, through the makeshift testing sites we identified 3 additional patients who were foreigners, and we are also conducting massive testing and tracing. And in Gyeonggi-do Province, Icheon City, in relation to the amateur soccer club gathering, we have 3 additional patients being confirmed. In total, we have 14 being confirmed to date. And in Gyeonggi-do Province, Suwon City, in relation to a daycare center, we identified the first index case on the 6th of March. We identified 11 additional cases, raising the total to 12 to date. And moving on to Chungcheong Province. In Chungcheongnam-do Province, Cheonan City, in relation to a family, we identified the first index case on the 6th of March. We identified 7 additional cases, and in total, we have 8 being confirmed to date. And in Chungcheongnam-do Province, in relation to a Yesan-gun County battery manufacturer, we also identified additional cases of 6 more people, and in total, we have 7 cases being confirmed to date. And in Chungcheongbuk-do Province, Checheon City, in relation to a sauna, we identified the first index case on the 6th of March. We identified 8 additional patients, and a total of 9 people have been confirmed to date. And in Chungcheongbuk-do Province, Eumseong-gun County, in relation to a glass manufacturing company, we have the total standing at 24. And moving on to Honam Province, in Gwangju City, in relation to the Seogu's call center, we also identified additional cases of 32 more people, and in total we have 118 being confirmed to date. And in Jeonbuk, Jeonju City, in relation to a fitness center, we identified 3 additional patients, raising the total to 71. And moving on to Gyeongsangbuk-do Province, in Daegu City, in relation to a family and fitness facility in Junggu District, we identified 1 additional case, and in total we have 11 being confirmed to date. And moving on to Gyeongsangnam-do Province, in Busan City, Seogu District, in relation to a general hospital, we have 5 additional patients being confirmed. In total, 12 people have been confirmed to date. And Ulsan City, Bukgu District, in relation to a public sauna, we identified the first index case on the 7th of March. We identified 7 additional patients, and in total, we have 8 being confirmed to date. And moving on to Gangwon-do Province now. In Gangwon-do Province, Pyeongchang-gun County, in relation to a lodging facility, we identified 2 additional patients being confirmed, and in total, 7 have been confirmed to date. And moving on to Jeju Island, in relation to the second bowling alley in Jeju City, we identified 7 cases in total. And lately, we are also seeing many young people being contracting with the virus, especially through multi-use facilities. Here are some risk factors. After January, we have seen that many young people also have been visiting clubs and also other facilities, and we have identified about 13 new cluster infections, and about 280 people have been confirmed with the virus, and it took about 10 days to spread the virus. And we believe that the virus has spread not only within the facilities, but also through their family members as well. And as a representative example, we also have the Seoul's Gwangjin-gu district, the restaurant, as well as other university campus outings. And we believe that these social gatherings, especially related to these two cluster infections, we have about 82 and about 24 of people being contracted with the virus respectively. We identified that the risks are improper wearing of face masks and also long time staying at these facilities. And we also identified that they engaged in activities that increased the travel of respiratory droplets as well. And we tell you multiple times, however, if you do not wear your mask properly at multi-use facilities, this can raise the risks of infection. And please refrain from visiting these multi-use facilities if they are not essential. And please also keep adhering to these hygiene measures as well. In order to expand the massive testings in the metropolitan areas, we have the makeshift testing centers being run here in the country, in the metropolitan area. We will be expanding this to a non-capital area as well. And we have been carrying out these operations, and we have been able to identify the cases and the patients at an early stage. And regardless of their symptoms, anyone can get tested at these centers, and we are going to expand them from the metropolitan area to non-metropolitan area as well. And by regions, we will be receiving the demands from each of the local governments, and they will be installed at Daegu, Asan, and also Cheonan, and about 6 local districts will be operating them. And after a certain period of time, we will also mull over expanding them even further. And as mentioned so far, we are also testing anyone at free of charge, regardless of their symptoms. So if you have any suspected symptoms, please visit these testing centers that are nearby. And next, we have the vaccination status for the COVID-19 vaccines. As of March 9th midnight, 64,111 more people have been administered with their first dose of COVID-19, with the total vaccination recipients standing at 383,346, and about 49.8% of the population, the targeted population, have been inoculated. And by also facilities, we also carried out the administration of the vaccines to about 10,000 COVID-19 first responders, and also at the COVID-19 hospital, about 6,200 people have been administered with these vaccines. And as for the post-inoculation adverse effects, we have a total of 4,851 cases being reported, and out of them, 4,790 cases are mild and common symptoms following inoculation, including headache, fever, nausea, and vomiting. We have 43 suspected cases of anaphylaxis and 5 cases of convulsion, and 13 cases of death have been reported, which are under investigation right now. And South Korea, as well as the international community, is battling against the COVID-19 for the past year or so, and we are also battling against the new rapid spread of the new variants, and we are also seeing a high level of fatigue of these prolonged social distancing measures, and we also have the challenges posed by this widespread and the wide range of the inoculation that are being carried out right now. And until we reach herd immunity here in South Korea, we are carrying out strategies that we can contain the virus further here in the country. And going further, we will be identifying the risks, and we will also contain the virus and contain the risk factors as well. We believe that we are at a challenging point of time. However, we believe and we have confidence in the scientific technology that we have here at hand, and with the dedication and sacrifice of many, we will be able to overcome such a challenge right now. Nevertheless, we believe that the quarantine can be only completed thanks to the participation of the individual public, and once again, we would like to urge the public following. Please note that if you are exposed to social contact with anyone else, please wear your face mask mask. And rather than worrying and being concerned about the infections, please wash your hands once again. And please also comply with the quarantine measures, including social distancing measures as well. And if you have any clinical symptoms of COVID-19, please get tested as soon as possible. And the quarantine authorities will also make sure that we carry out continuously the massive testing of COVID-19 and also trace the patients and also conduct our epidemiological investigation as well. Thank you very much.
Right, so that was Lee Sang-won with Tuesday's afternoon briefing. What did he have to say?
He had some warnings regarding a rise in COVID-19 patients among the younger people. As he said, from the beginning of January, there were 13 new clusters related to places where young people went to, such as restaurants and bars. And there were over 280 confirmed cases of young people. So he said the infection is spreading not only at such facilities, such as multi-use facilities where these young people are going, but the viruses can then spread among family members. So he said this was due to not wearing face masks properly and also staying too long at such facilities. So encouraging people to get tested for the virus at temporary screening centers, stressing that makeshift centers are going to be expanded across the nation, not only in the capital region, including in Daegu, Asan, and Cheonan, and that's free of charge regardless of symptoms. And just a quick update on the recent cluster infection in Gyeonggi-do Province's Ansong at a livestock facility. The total there now stands at 77.
I see. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, up next, we share with you a list of the do's and don'ts amid COVID-19 vaccination as shared by medical experts. Do take a look.
There are several important rules of thumb to follow to minimize your risk of side effects and maximize your immunity after getting a COVID-19 vaccine. Painkillers are useful in managing light post-inoculation symptoms, such as headaches and muscle pain. However, medical experts say that painkillers should not be taken prior to getting your shot.
염증에 영향을 주는 진통제 같은 경우에는 백신 효과를 떨어뜨릴 수 있다라는 보고가 되고 있습니다. 연구들이 보고가 되고 있습니다. 그래서 백신 접종 전에는 가급적이면 진통제를 복용하지 않으시는 게 좋고요. 그 다음에 백신 접종하고 나서는 몸살 기운, 특히 발열이나 통증 같은 것들이 좀 있으실 수 있는데요. 그런 경우에는 가급적 아세트아미노펜, 우리가 흔히 말하는 타이레놀 같은 진통제를 복용하시는 게 좋고요. 그 다음에 다른 진통제는 가급적이면 복용하지 않으시는 게 좋습니다.
Also, if you're interested in donating blood for a good cause, how long must you wait to be eligible after getting vaccinated?
코로나19 백신을 접종받은 후 7일이 지나면 헌혈할 수 있습니다. 다만 접종 후에 이상 증상이 있는 경우에는 증상이 사라진 후 7일이 지나서 헌혈할 수 있도록 하였습니다.
Korea and many countries across the world have released independent guidances on blood donor eligibility for those who've recently been vaccinated.
Blood donation is essential. It helps to save our life. But after the vaccination, we have the immunological reaction in our blood. Sometimes it can be affected to the recipient. So that's why we recommend for after 7 days, usually.
For women in the US looking to get screened for breast cancer, health experts there are recommending people to delay getting a mammogram until 4 to 6 weeks post-inoculation. This follows research showing that COVID-19 vaccines could lead to false positive mammograms as a result of swollen lymph nodes.
A subset of patients who received a COVID vaccine will have what we call reactive adenopathy. That is that the lymph nodes in the underarm area, the axilla, can get big. And that's a very normal response. Another reason for enlarged lymph nodes is breast cancer. Now, COVID vaccine, of course, is different from breast cancer, and COVID vaccine lymph nodes that are big will go away with time. So waiting a little bit of time, such as 4 to 6 weeks, is a good idea to make sure that any lymph nodes that are big go away so that there's no confusion with detection of breast cancer.
In December, the US FDA announced that Moderna's vaccine may cause side effects like swelling in people who've received facial fillers. But experts say this is all part of the body's natural immune response, and that such symptoms are easy to treat.
마취주사, 영양주사, 미용주사 이러한 것들이 금기라고 생각하지는 않습니다. 다만 인과관계가 있을 가능성이 있는 사례가 필러를 사용했던 분에서 있었으니까 혹시 백신을 접종하는 분이라면 그런 사례가 발생하지 않는지 관찰해보는 것 정도는 필요하지 않을까 생각을 합니다.
Be sure to take note of these precautions in order to get vaccinated safely and to return to our healthy, normal lives.
지난 1월 중순부터 7주간 매일 300에서 400명의 환자가 발생하고 있어 결코 안심할 수 있는 상황도 아닙니다.
이번 거리두기 체계 개편이 성공하려면 생활 속에서 자율과 책임이 방역의 탄탄한 기초로 자리 잡아야 합니다. 논의를 이어가며 내용을 다듬어 나아가되 그 적용 시점을 미리 정하기는 어려운 상황입니다.
Our battle against the third wave here in the country has been ongoing for almost 4 months now. Daily caseloads currently hover in the 300 to 400 range. And given the recent trends, the belief is that this number could hit 600 on a daily basis in the near future. For more, I have Professor Chung Gi-seok from Hallin University. Good to see you again, Professor Chung.
Thank you for having me.
And I also have Professor Shim Eun-ah from Soonchil University. Pleasure to have you with us, Professor Shim.
Thanks for inviting.
Right, Professor Chung, what do you believe has been hindering our efforts to contain this third wave?
Yeah, I'm a bit worried about that. It's been over a month since we have a constant number around 300, 400. And on top of that, the government eased the social distance restriction level from mid-January until now. So what are we expecting? We could see a definitive decline. We need some different measure. The different measure will be imposing a more strong sanction or preventive measures, search for hidden densely populated area like a dormitory, factories, and etc. Apart from that, we are expecting only the weather to be warm. Getting warmer means less spreading of a virus.
Right. Professor Shim, you are a member of the COVID-19 Mathematical Modeling Task Force. I understand authorities depend on your calculations to forecast transmission rates and risks. Please tell us a bit about your projection platform and its accuracy.
Sure. So mathematical modeling of disease transmission has a history of more than 100 years. So we have been using it for a long time enough. And out of all the possible technology and methodology, for big population, as in the COVID-19 pandemic, we can use a differential equation modeling. So what we do is that we can divide the population into multiple compartments. The one for susceptible people, the one for infectious people, another one for Curvit, and also we can consider vaccinated people. And for the infection, we can further subdivide the population into asymptomatic infection and symptomatic infection. And that's a simpler version of it. What we use actually is much more complex than that. And what we do is we operate the system mathematically, and we simulate using computing simulation. And we do coding of our equation to predict and come up with the best strategy to combat the disease outbreak. So this is how we do as a mathematician to make a further prediction. And when it comes to the accuracy of it, the mathematical models are only as good as our assumptions. So what we do is that, well, we make predictions and we compare it with the current situations. And if our predictions are out of line when it's compared to the current prevalence, then we go back to our assumptions and fix our model. So we do this kind of going back and forth. And the models are not completely fixed. We do these changes and the justification as time goes by. So that's how we do as mathematicians.
I see. A lot of work is involved. Yes. Professor Shim, what is your projection of the current COVID-19 situation in the country? And how far into the future can be forecast using your formula?
Well, we do estimate the reproduction number. This means the threshold level in terms of mathematics to tell us whether the disease will die out or spread further. So if this number is greater than 1, the infection is likely to be more transmitted and the transmission will go on. But if this number is lower than 1, then disease is likely to die out. So current estimate of this number, it's between 1.0 and 1.1. So what it means is that unless we do something different, unless we do change our social distancing measures and participate in social distancing more actively, the current pattern is likely to be stay at the same level or getting even worse. So that's what we're concerned about. And with the warmer weather, what people do is to travel more and enjoy social activities and go out even more. So that factors, it all contribute to further infections. So that's what we are concerned about.
I see. And Professor Chung, do you share Professor Shim's outlook for the current situation here in the country?
Yeah, it looks intriguing. And the sophisticated calculation could be leading to one of quarantine policy measure. But some models like I experienced when I was director of a CDCH, the Zika model or the dengue fever model, I was facing, because at that time that was a big concern to our country. And I couldn't see a very significant prediction rate or prediction result. So I realized that there should be, maybe Dr. Shim could accept that, there should be a big gap between the real world and calculation. So for example, the infectivity of a patient or infectivity of a virus and the duration of viral shedding, all factors, and even the weather, and social gatherings and social distancing level. And she mentioned that it could be changed every week or so, but chasing the trend sometimes cannot be enough. So anyway, I do hope that that kind of calculation will contribute a lot in our COVID pandemic.
Right, of course. Professor Chung, authorities have revamped their social distancing measures to a simplified 4-tier system that places great emphasis on civic engagement and responsibility. What do you suppose was quite notable in this new proposal?
It's a bit confusing because we started with a 3-tiered social distancing level last year. And then the modification began very severely until November. And the government made their mind to go for a 5-degree social distancing level. And just after 3 months, they are talking about the 4-tiered level. So what happened during that time? A new paradigm is talking about autonomy and the responsibility and the booming of economic activities. That's very good. But the negative part is too complicated. It's 3, 5, 4, then what? And we saw the government didn't even go to the highest level, level 5, level 3, despite all the conditions were satisfied. So the government would go for a level 4 when they meet everyday patients level more than 1,556. And they will not allow 3 or more people to gather after 6 p.m. That's a lockdown of a city. Would it go? So I'm very questioning about that. And the other thing I like to mention is utilization of medical resources. That is not considered in 4-tiered level. So how to use doctors and nurses and general beds and ICUs, you have a plan. And also, we are having always more than 20% of unconfirmed infection sources. So you need to establish a plan about epidemiology investigation service. When you have a higher level, then you have to reinforce the EIS system.
Right. Professor Shim, do you believe the revised guidelines that have been disclosed this past weekend and our vaccination campaign itself will affect future patterns of our transmission, keeping in mind, of course, your model for prediction?
Sure, yeah, I think it will. So Korean government is looking to revise social distancing scheme. And under this revised scheme, the threshold level for restaurants or cafes to stay open, that will be raised to 1,550 new cases per day, which is higher than what it is now under the current guidelines. So, those have the reasons, just because we are capable of handling more patients than what we were doing in November last year when the current guideline was in place. So that's the main reason. And also, we want to save the economy. I guess that's the big driver for that. But we have to remember that we are still in the early stage when it comes to vaccination campaign. And as of today, only less than 1% of total population have been vaccinated. That's not a big number.
Right,
so that's one thing that we need to keep in mind, and also the existence of variants. And we have found that those variants are likely to be more transmissible and more deadly. The one from the UK, that's actually 50% more transmissible and more deadly. So that's one thing. And also for the other 2 variants, we have found that the vaccination might be less effective against those strains. So the impact of variants are twofold. One thing is that it's more dangerous. The second thing is that, vaccination is less likely to be effective against those variants. And also we have to remember that once we start vaccination and vaccination speed is not fast enough, then vaccination might exert a selection pressure on this variant strain. So in terms of, when it comes to perspective of virus, the vaccination will work out in favor of variants. The prevalence might change over time. So what it means, we need to vaccinate fast enough. So we are in the race of time, actually. So we need to vaccinate fast enough before the prevalence of variants become high or higher than current strain.
Right. And in order for the vaccination to take place very quickly, we need vaccines, right?
Right.
Professor Shim, how does Korea's mathematical modeling of COVID-19 compare to that of its counterparts elsewhere around the world?
Sure. In order for mathematical model to have a better result, an accurate result, we need to have a country-specific parameters, and that's what we are doing. When we feed in the country-specific parameters, then we are able to generate the country-specific outcomes. So that's helpful for policymakers, I guess. And we have been providing real-time estimate on reproduction number and share our result with the CDCH on a weekly basis since November last year. And I hope that was helpful. And as well, we also obtained daily updates on the data, age-specific instance data and death from CDCH. That has been open to general public. That was very helpful for us to parameterize our model and update our results. And we were able to share our results with the policymakers as well. And also, what we do is we update our model with a daily update, but at the same time, we do region-specific modeling, because 70% of new daily infections are occurring in Seoul and metropolitan areas. So we look at those areas separately from all other regions in Korea and do the separate modeling. And that's very helpful when it comes to the interpretation of modeling outcomes. Because in metropolitan area, population density it's much higher, right? And they have a specific contact patterns. We have much more populated areas here and there around the downtown city. So that has been realistic and helpful when it comes to COVID-19 modeling. And also for Korea, we have a very low percentage of positive COVID-19 tests. And what it means? Well, that means that we are doing widespread testing. And that's not very common compared to other countries. So that means that our proportion of asymptomatic infection, that seems to be very accurate, I should say relatively accurate, because no data is perfect, right? So that has been helpful when we do parameterize our model. So that's good for mathematicians and also for policymakers when we provide our modeling result and share them with it. So for various reasons, the Korean mathematical modeling of COVID-19 has been special in certain aspects.
Right. And keeping in mind what Professor Shim has just said, Professor Chong, speaking within your capacity as the former director of the KCDC, back then, of course, how important is the role of mathematical modeling in drafting policy, disease containment policies?
I think it's important. It should contribute somewhere in making a policy. And as Professor Shim mentioned, she talked about 70% comprising Seoul area, the infection rate. So I do hope that she could make a very nice model for controlling a metropolitan area, because as I said before, there is no way to control that apart from level up. But it's not the time to level out, and it's not the time to impose a very strong sanction. So, regarding RO, it's very interesting and sometimes a funny parameter, because I saw RO 1.1 a couple of weeks ago, and at that time, average week occurrence was over 400. And people usually think that if RO is 1.1, next day we'll have more than 400, around more than 400. But next week we saw 300 something confirmed cases, and RO was less than 1. So you have to know that the RO is reflecting a current situation, not predicting a near future or far future. So, despite that, I do hope that the RO could be contributing something. And another role of RO is predicting the immunity population in Korea. Because if, say, the RO is 2, one patient can impact 2 healthy people, and then we can calculate the amount of number who are immune by 1 minus 1 divided RO. So if RO is 2, 1 minus 1 divided 2 is 0.5. That's 50%. So when RO is 2, the 50% of immunity in your society can make herd immunity. So that's why KDCA is persisting on the 70% of whole population get inoculated. Then we can calculate from 70% who can make 80% of whole that population could make antibody.
Right.
So that makes 70% multiplied by 80% is 56%. So that could accomplish the herd immunity if RO is 2. But RO is higher than that, we should inoculate more than 70% of whole population. So RO is very interesting parameter.
Professor Shim, your task force has been making weekly COVID-19 projections since last November. Have there been any significant patterns that you'd like to share with us?
Sure. So there has been notable characteristics around third wave of pandemic in South Korea. So first thing is that the strengthening of social distancing policies was delayed for the third wave compared to the second wave. And that's why we're having a longer duration of the third wave compared to the second wave, which only lasted about 40 days. And we have higher case fatality rate for the third wave just because we have a higher number of infection among the elderly who has a higher rate of fatality rate. So overall, if you look at the distribution of cases over all age groups, then we will be able to see that more than 50% of cases are occurring among younger adults aged 20 to 59 years. And those people are a socially active population, and it means that we have to vaccinate them as early as possible to cut the transmission, and that way we will be able to cut the transmission further to the elderly who are a vulnerable population. So that's the one way we can proceed with the vaccination strategy. And also, when it comes to case fatality rate, we have to be careful because what we have been doing so far is to divide total number of deaths by total number of infections. But if you think about it well, the total cumulative infection up until today, for example, that includes people whose outcomes are not known yet. Some of them might survive, but some of them might die from infection. And that number is not included in our calculation. So those delay adjustment has been made when we do the research. And when we do the adjustment, we found that the case fatality rate among the elderly aged 80 years or older, that number is 22%. So case fatality increases dramatically with age compared to 2% for all ages. So 22% is pretty high compared to 2%
very high, of course.
if you look at the age group separately. So those interpretation out of modeling result can be useful, I think.
Right.
And also, what we can do now is to compare the economic analysis for different vaccines and calculate optimal strategy to vaccinate the population, given that the initial supply is very limited. That's what we can do with mathematical modeling.
Right, and hopefully you'll be back with us to talk to us about that as well. Professor Chong, as always, thank you for being with us. And Professor Shim, thank you for your thoughts today.
Thank you.
Right, vaccination, social distancing and preemptive testing are our current tools against COVID-19 infection. So do seek to make the most of them. Thank you for watching. See you tomorrow.